Ladies and gentlemen, good evening and welcome to Doctor in the House, the #1 show that provides you with the news and views of all things medical. So as usual, we are live on Monday nights, but there's a rerun if you miss it on Saturday afternoons at 1 p.m. So tell your friends and family. So as a result of the holy month, and it's actually my last episode for this season. We usually take a short break to recharge our batteries, and the entire team should be back in September. Thank you to our beloved viewers. It certainly provides us with the impetus to do better on this show. And as usual, let's start with the news. It's been unfortunately dominated this afternoon by news of that horrific fire at the Notre Dame Cathedral in Paris. That historic landmark in Europe has stood for close to 850 years, and many of our viewers would have actually visited it. And it was due for actually renovation. And it really is a tragedy. I think a lot of persons, not just in France, but we certainly join with the French population in hoping that some of the Notre Dame Cathedral will be salvaged. It holds a lot of monuments, a lot of landmark paintings, and a lot of memories, a lot of cherished memories for the entire world. So inclusive, it's thought that a part of the cross that Jesus Christ and it's a reminder that we celebrate Holy Week as we remember the crucifixion into Hanuman Jayanti, and of course, as we mentioned, the holy month of Ramadan for Muslim viewers is fast approaching, and we'll be talking a little bit more about that during the course of this evening's show. And Patriots Day was today, actually Monday, the 15th of April. Patriots Day in some parts of the United States, like Massachusetts, usually marked by the Boston Marathon. So that's actually some aspect in which a lot of persons are practicing and trying to keep healthy. A few years back, there was a terror attack at the Boston Marathon, and that was in the news. So in certain states, Patriots Day, that actually marks the start of the U.S. Revolution for Independence. So you're learning something on Doctor in the House. Although school is out for the Easter vacation, I know in the last term for the academic year, exams will be beckoning, and a lot of the news in the last week dealt with the challenging maths questions that some of the students would have encountered in the recently completed SEA examination. Certainly wish all of our student viewers God's blessings in this exam period. The hydra-headed monster of crime, that scourge certainly dominated headlines over the past month with wanton slayings by reputed gang members, and not just local ones now. So we have some from neighboring Venezuela, and there have been so many allegations of the failure of the police to protect vulnerable members of the society. And that was a grim reminder in the last few days in the mass media about a silent epidemic of child abuse locally, with some persons actually estimating that 12 children are abused daily in this country. So some terrifying news there in the world of crime. However, the politicians continue to also probably engender laughter amongst most of the citizenry. So whether or not it's intentional is another point for debate. But they spoke about the wealth bill, but the unexplained wealth bill, whether many persons will be charged. It's interesting, though. So as a part of this bill, if any of the politicians will be charged subsequently to that, and actually explaining how they got their wealth. So it's important to look after the health of all persons, to make them more stable and strong, to complete any task easily and quickly. And the theme of World Health Day, which was last week, is universal health coverage for everyone, everywhere. So and I thought that there was a video from the World Health Organization, just a reminder about the value and importance of health. And one of the definitions of health is that it does not merely mean the absence of disease or infirmity, but a state of complete mental, physical, social, and psychological well-being. Let's have a look as part of World Health Day on Doctor in the House.
Where's Ben? Ben, up. Gotta leave soon.
I'm not feeling well.
You're not gonna get out of going to school that easily. Up. You can't be late. Mia, come. We're gonna miss the bus. Ben's not doing well. Did you manage to get the medicine?
No, they didn't have any.
I'm sorry you're feeling so horrible, my darling. And how much is it going to cost? Are you sure? Just for an appointment. What if we don't have the money?
Tell them about his fever.
I have. No, I wasn't talking to you, sorry. Surely there's got to be something you can do for us. What if he gets worse?
No, it'll be okay. We'll find a doctor tomorrow.
And how much is that going to cost? Listen, you get me to school, I'll take Ben to the clinic.
You sure?
It's fine, go to work.
Mom,
What's Mia?
Ben needs help.
Tom, we're gonna have to get a taxi. Please call one now.
Just a reminder that that theme for World Health Day, trying to get health for all. Locally, there was a tuberculosis scare, so in the last week at UTT and TN Tech. So I think that that is worrying, especially as we think about the fact that this is a contagious respiratory tract infection. So it can be spread by droplets in the air. It might infect not just the lungs, but it can also affect the lining of the brain, the kidneys, and the spine. Some of the symptoms include a cough. You may actually start to bring up blood, fever, sweating at night, a dramatic weight loss, chest pain, so a plethora of symptoms. So if you're unsure, check with your doctors. So it requires treatment. So the Cora Chest Hospital is frequently employed to manage these patients. So, and I know that a lot of persons, especially if they're working at those institutions, would need testing and perhaps some calm. So a call for calm from the Minister of Health. There are some fears as well, too, as we stay in the topic of infectious illnesses, some fears in Jamaica about a spike in the incidence of HIV. So that's the virus associated with AIDS. And they found that the incidence has been escalating in Jamaican prisons. And at least one priest there has actually advised that maybe prisoners should be given condoms. It's been said, though, that about 1 in 8 men who have sex with men actually test positive for sexually transmitted infections when swabs are done in the rectum and throat. And many of those persons have no symptoms, so they can act as reservoirs of infection. So when you think about this silent epidemic of HIV that occurs in the prisons, and those guys are then freed and then spread infections to partners outside of prison, it's important to know your status. So just a reminder. So we don't have to wait for World AIDS Day in December to actually remind you to know your status when it comes to HIV. The mayor of New York City has actually declared a public health emergency last week because of a huge spike in measles in that city. 285 cases over the last few months, especially amongst the Jewish areas of Brooklyn, New York. So since there were some unfounded fears about the measles, mumps, and rubella vaccine, persons were not vaccinating their children. So there's actually a resurgence in measles, something that we very rarely see, if at all, in Trinidad because of the brilliant expanded program for vaccination. And it's mandatory if you want to get your children into primary school. It's mandatory that you get certain vaccines, and you have to present the vaccination card, but the immunization card, on entry to school. Staying in this whole idea of public health, it was nice to note that a training program for pest control operators to safeguard human health and the environment, that training program in conjunction with the University of the West Indies was recently launched. And there will be increased spraying, according to the Ministry of Health, to curb a dengue outbreak, as changes in temperature, rainfall, humidity, and other weather patterns can facilitate the spread, persistence, and biting of mosquitoes. And we know that usually at the start of the rainy season, there's a surge in the incidence. We know about dengue, but we've had our little problems with chikungunya and Zika viral infections, all spread by the mosquito, the Aedes aegypti mosquito. Just a reminder to use your repellents and protective clothing if you think that you may be exposed, and staying indoors during prime biting times, which is usually around dusk, and getting rid of anything that might allow insects to breed, such as stagnant water in buckets, tubs, or tires. So your health is in your hands, not just, and we usually try to talk about it when we're speaking about healthy lifestyles, not just about things like viral infections or TB, but also about mosquito-borne illnesses such as dengue. The destruction of forest in Granville by a private contractor was also noted in the news, and let's hope that a regional corporation is able to crack down on that as we talk about protection of the environment and the health consequences if we don't address things like climate change. And water woes in some parts of the country continue as well during the dry season. And it has been a rather blistering one so far. Car fires and noxious fumes from the fuel as well that we have been using for our motor cars have ignited fears amongst consumers. I wonder whether the health of workers, I haven't really heard a lot of persons speaking about it, but this particularly pungent fishy odor from some of the fuel that has recently been provided to gas stations locally can be exposing it can be exposing the workers at these gas stations to certain health risks. Whether or not that will be explored remains to be seen. And the Sahara dust continues at particularly high levels. That has been associated with a plethora of respiratory problems in the population, especially persons who might be so prone, like asthmatics or persons who have issues with sinus infections. The Red Cross has gained access to prisons in Venezuela over the last week to deliver much-needed humanitarian aid to crisis-torn Venezuela. And locally, I know that there have been issues in the news about registering migrants and how it is that we're going to proceed about legalizing the status for some of these migrants. And the Afghan Taliban has actually banned the World Health Organization and the Red Cross from operating in areas under their control until further notice. And they have been saying that there have been suspicious actions during some of the vaccination campaigns in Afghanistan. And polio, unfortunately, which is a viral infection usually spread by contaminated food and water, polio is actually still endemic. That's one of the countries that still has rampant polio infections, Afghanistan. But the vaccination efforts have actually been stymied in war-torn places such as Afghanistan and Syria. There was a huge pediatric meeting recently in the United States, and that has been focusing a lot on many of the terrifying threats to child health, such as poverty, malnutrition, many of the preventable illnesses like measles and polio, and of course stress due to poisons and chemicals. But this year, at that meeting, the twin burden of undernutrition, so that is a lack of food, and obesity was actually discussed, because many of the foods nowadays, especially in westernized countries, inclusive of the West Indies, they are mass-produced, cheap, but yet very dense in calories. And they're seeing, so as a result of obesity, resistance to insulin and an increased tendency towards type 2 diabetes in children. So type 2 diabetes, we used to see that in older persons, but they're noticing it in younger individuals now. And that's as a result of diet, a poor diet, and of course a sedentary lifestyle. So it's just a reminder that it's a call to arms. It's a red flag that we need to be paying more attention to the health of children, especially with respect to weight gain and obesity. Fascinating study too, that nuts, I'm eating nuts. I know that my family, we have a love for that, and it's found to actually reduce the risk for heart attacks, strokes, and death in persons with type 2 diabetes, according to a study in the United States. The researchers found that persons who had high levels of nut consumption, especially tree nuts like walnuts, cashews, and almonds, were tied to a greater reduction in the risk for having a heart attack or stroke. So great news there for nut lovers all over the world. There are guidelines for screening in breast cancer from the US Physician Association, and they found that women aged 40 to 49, perhaps it would be better to talk about the risks and benefits with respect to mammograms. For most women in that age group, 40 to 49 years, the potential harms probably outweigh the benefits. But as you go into ages 50 to 74, you want to think about mammograms every 2 years. Persons over the age of 75, when the life expectancy is thought to be under 10 years, you want to stop screening. And they weren't too keen actually in breast examination, self-breast examinations as screening tools, but perhaps, of course, women very often, women or their partners can often feel lumps, and that can be a red flag that it's time to actually have further testing like an ultrasound scan, a mammogram, and seek medical attention. So for younger women ages 40 to 49, you may want to weigh pros and cons about whether or not you're using a mammogram. The tissues are different too. If you're 50 to 74 years, you're thinking about a mammogram every 2 years. And if you're over 75, it would be something to chat with your doctor about, especially in persons with a limited life expectancy. Maybe you're thinking about stopping screening. And staying in the United States, the federal authorities there have actually broken up a $1.2 billion scam in which doctors were actually writing bogus prescriptions for braces, you know, back braces for persons with spinal injuries or leg braces, whether patients needed it or not. So you're thinking that healthcare is so great in some parts of the Western world, but this was a $1.2 billion scam where persons were actually getting prescriptions. And we always hear that persons have procedures done just so that their insurance companies can be billed in places like the United States. Metformin, so that's a classic first-line drug used for type 2 diabetes, and for certain problems such as prediabetes and even for polycystic ovaries. And some research in the last week showed that metformin may actually increase the chance of pregnant women with polycystic ovaries delivering a full-term baby. So although the offspring was more likely to have increased weight gain as toddlers. It's thought that women with polycystic ovaries, some of the symptoms may include excessive hair growth, acne, so irregular periods, and there is a predilection towards type 2 diabetes, and women should lose 5 to 10% of their body weight to improve fertility. Staying in the idea of drugs used in the management of diabetes, there's a new class of drugs in which there is the excretion of sugar in the urine. So it acts at the level of the kidneys. And one of the members of that class, called canagliflozin, was looked at in patients with kidney disease. And just a few days ago, it was found that in more than 4,000 patients, that drug lowered the risk for progression to end-stage kidney failure. So those are persons who may be requiring dialysis by 30% in patients with type 2 diabetes. So it's the first results, it's almost like a landmark trial for kidney patients in type 2 diabetes, this drug preventing the progression. So in my last episode of Doctor in the House, we spoke about the concept of weight bias. So those are persons who have problems with the weight. They may be overweight, but they may be obese, and persons may actually be mocking them, jeering them. And they found that weight bias has been experienced by a number of persons at the airport. Apparently, there is a lot of extra time that's required to traverse the long walks between check-in counters and departure gates in the airports, and there is a lack of wheelchairs which are actually sized to fit larger travelers. So many persons actually rather go on a cruise ship rather than fly as a result for that. And persons spoke about embarrassment during air travel. There's the discomfort that they feel in flights and the bias that they get from other passengers. So we know that the aisles are very narrow, and many of the airplane seats are actually so small that you require seatbelt extenders, and they often are very bright orange. And persons who find that they're struggling with their weight are frequently barred from sitting in the emergency exit rows. So silent weight bias, and I can often think about a lot of persons traveling on an airplane and struggling with the seats. They're struggling with the wheelchairs which are provided, the seatbelt extenders. Sometimes you're getting dirty looks from some of your fellow passengers, and persons are struggling with that. It's a psychological aspect when you're traveling, and something to consider. And perhaps the airlines should actually be thinking about improving this whole idea of weight bias. Of course, we know the airlines don't care about anybody except themselves and the money that they're going to gain, but nonetheless, it's something to consider. They're really just there to make us suffer when we're traveling. So, right, and some studies in the UK now, so one of the journals in the UK is called the British Medical Journal, and there was a 30% increased risk for developing type 2 diabetes among men who had prostate enlargement, benign prostate enlargement. So the prostate is the walnut-sized gland which is located near the bladder in men. It normally makes the secretions that nourish sperm in semen. And this prostate gland, as we know it, gets bigger in all men, so over 50. And there is the potential for cancer, especially in the Afro-Trinidadian and in persons with a family history. But it can happen in all men. But many of us will eventually have benign enlargement of the prostate. And that may lead to increased frequency of urination or problems. It's almost like an obstruction to relieve oneself. And there is a family of drugs which are used in benign prostate enlargement called 5-alpha reductase inhibitors, so that's the big name. And some of the drugs include finasteride or dutasteride. And they looked at them in this study, and they actually found that you're helping one thing, but there was a 30% increased chance for becoming a type 2 diabetic. So if you're using drugs for your prostate gland, for benign prostate enlargement, perhaps it's something to just mention to your doctor, whether it's your primary care provider or your urologist, whether or not you should be screening for diabetes. And the same things that we talk about in terms of healthy lifestyles, diet and exercise, a diet which is rich in fruits and vegetables, nuts, peas and beans, low fat and low salt foods, that sort of trend, and ensuring that you get about 30 minutes of some form of exercise, some form of physical activity every day to prevent not just type 2 diabetes, but all of the complications of weight gain and obesity. So there was a fascinating article as we're talking about healthy lifestyles, which I got from one of my colleagues at San Fernando Hospital, Dr. Kevin Singh, who is one of the young specialists there. He sent a fascinating article by Dr. Sanjay Gupta, who is the CNN health correspondent, and he spoke about his recent trip or pilgrimage that he made to his homeland in India. And there has been a resurgence in interest about mindfulness when you eat, that you're actually thinking about the sort of food that you're eating, whether or not, and the times that you eat. So it's a return to a simpler time, that you're moving away from these mass-produced, calorie-dense foods and looking back to some of the so-called natural foods which were part of our forefathers' diets when they first came to the Caribbean, thinking about the fruits, the vegetables, the cinnamon, the so-called Saigon or moringa, karaili, things like that for the management of type 2 diabetes and so many chronic diseases. So a fascinating article there about being more mindful and a return to a simpler way of eating. So we usually mention a little bit of sport, and the cricket corner, the West Indies players continue to do well at IPL, and we have an impending World Cup 50 over tournament in England. So let's hope that now, with a new board in place, a new administrative board in place, the West Indies team will be going with a full-strength contingent to that tournament. And a fantastic comeback story on Tiger Woods over the weekend at the Masters tournament as he won it. So everyone thought he was done and dusted, and he's back. So after a nasty split, he had spinal surgeries. He was charged for driving under the influence, and he's back. It's a reminder about the resilience and strength of the human spirit. As we close this segment in the Medicine Corner, worldwide, 94% of the nearly 150 million Muslim patients with diabetes will choose to fast for most days during the holy month of Ramadan. And there is an excellent video. It's a few years old, but a lot of the information is still very relevant as we approach the holy month of Ramadan. And it's going to deal with diabetes and fasting. Let's have a look.
My name is Yasrin Elmi. I volunteer at Diabetes UK. This presentation has been designed as a guide to managing diabetes during Ramadan. The presentation has been approved by clinical advisors at Diabetes UK and imams based in London. Introduction to Ramadan. Ramadan or Saum is one of the 5 pillars of Islam. Fasting during the month of Ramadan means abstaining from food, drink, and several other things for 30 days. Most people take 2 meals, one meal before dawn known as Sehri and Iftar, the meal after sunset. The month of Ramadan follows the lunar calendar, so fasting is brought forward by 10 days each year. This year it will begin on the 9th of July, followed by celebrations known as Eid al-Fitr. Who is exempt? According to the Quran and Sunnah, there are certain groups of people and circumstances where you may be exempt from fasting. For example, children under the age of puberty, the elderly, the sick, those with learning difficulties, those who are travelling, pregnant, breastfeeding and menstruating women. However, should any one of you be sick or on a journey, then he should fast a number of other days equal to the ones missed. In Surah Baqarah, Ayah 184, and as for those who fast with difficulty, they have a choice either to fast or to feed a poor person for every day. The impact of fasting on the body. For someone who is fasting, it is the norm to feel hungry, thirsty, and lethargic, but this is often exaggerated in those with diabetes. Usually your body enters into a fasting state 8 hours after the last meal. From this time onwards is when you are most likely to display symptoms of hypoglycemia. This may cause some difficulties in maintaining your blood glucose levels. Later on in the fast, your body will break down your fat stores for energy. If you have a blood glucose meter, it's important that you check your blood glucose levels regularly during fasting. Potential risks when fasting. Risks of fasting with diabetes include hypoglycemia, hyperglycemia, and dehydration. Hypoglycemia, when glucose levels are too low. Symptoms include shaking, sweating, blurred vision, tingling of the lips, irritability, anxiety, fast pulse, palpitations. Not all people with diabetes will be at risk of hypos, only those with insulin or using certain medications. Hyperglycemia, when glucose levels are too high. Symptoms include thirst, increased urination, headaches, extreme tiredness, and ketones, which causes a pear drop smell on the breath. This only occurs in people with type 1 diabetes. Dehydration. Symptoms include feeling more thirsty, decreased urinary output, dry mouth, lips, and skin. Remember, testing your blood glucose levels doesn't break your fast, so if you have the facility, test regularly. What are my options? Ideally, you should visit your doctor 2 months prior to Ramadan or at your annual diabetic review to discuss your options and review your medication. Healthcare professionals may categorize patients who would like to fast during Ramadan as either high, moderate, or low risk. If you are advised by your doctor not to fast, then it's important you take this into consideration. Acknowledge that your GP has some understanding about your health and appreciate this. It may be a good idea to do a couple of days in the month prior to Ramadan, Sha'ban, to see if one is capable of completing it without any complications. In some areas, there are education programs focusing on managing your diabetes during Ramadan. Patients who have attended this education program have had a significant decrease in hypoglycemic events. How do I manage my diabetes? It is important to always take your medication with your food, and during Ramadan, a suitable medication plan needs to be devised with your healthcare professional. Without discussing your medication with a healthcare professional, you may be at risk of hypos and hypers. A study found that the change in eating patterns during Ramadan increased the risk of severe hypoglycemia. Rigorous exercise is not recommended as the risk of hypos may be increased. If the patient suspects they have symptoms of hypoglycemia, they should break their fast. In Surah Baqarah, Ayah 195, make not your own hands contribute to your destruction. So it is important to look after yourself during Ramadan. If at any point you feel ill, break your fast. Food choices. It is good to maintain a healthy diet during Ramadan. Before and after fasting, include high fiber foods such as whole grain cereals, brown bread, brown rice, beans, pulses, fruits, vegetables, and salads. Foods high in saturated fats should be avoided, such as ghee, samosas, or pakoras. Healthy ways to break your fast include a handful of dates and some water. Take-home messages. Testing your blood glucose levels is important and it does not break the fast. If you have a blood testing meter, test your glucose levels regularly. Consult your GP in advance. Look for signs of hyperglycemia, hypoglycemia, and dehydration. Remember that not all people with diabetes will be at risk of hypos, only those with insulin or on certain medications. Make sure someone you know is aware that you are fasting. It is really important to do this because if you go into a hypo or a hyper, then they would be able to respond more quickly. Always carry glucose tablets, glucose gel, or a sugary drink. This may need to be followed up with a snack, such as a piece of fruit, biscuit, or half a sandwich. Finally, if you are ill, it is important that you break your fast. Here are some references. For further information, you can contact Diabetes UK. Thank you for listening to this presentation. I hope you found it useful.
Useful information, and if I could also remind you that testing your blood sugar does not constitute breaking the fast, and if you are unsure how to proceed, make sure you chat with your doctor. There are some newer drugs as well which are less likely to cause your blood sugar to plummet during the fasting period. And I think that it's a nice video since it encapsulates useful information, not just for Muslims who may be fasting during the month of Ramadan with diabetes, but all persons, because you have a lot of periods of time during the calendar year in which persons of different religions and races may find that they fast. Let's take a short break, and when we return, it's time for the open forum on Doctor in the House. Stay with us.
High blood pressure is as dangerous as an overpumped balloon. Measuring your blood pressure every day can save you from risk of high blood pressure. MicroLife fully automatic upper arm blood pressure monitor with stroke risk detection. MicroLife AFib screens for atrial fibrillation while taking your blood pressure. High blood pressure and atrial fibrillation are both considered controllable risk factors for stroke. If AFib is present during blood pressure measurement, the AFib icon is displayed flashing at the end of the triple measurement. Once 3 measurements are complete, the measurement data are shown on the display. MicroLife, a partner for people, for life.
Welcome back to Doctor in the House. The theme is healthy lifestyles. As usual, it's the open forum. We'd love to hear from you. So it's an opportunity. If you have many of the medical questions, feel free to call in. So as a reminder, when you're patched into the studio, just mute the volume on your television set and listen on the telephone. So don't try to listen to what is being said on the TV set, because it will be confusing and there is a bit of a feedback as well. So listen on your telephone and we'd love to hear from you. The numbers are on the screen now, and we will await your call. So in the meantime, I'd like to welcome the members of our delightful studio audience, Dr. Neela Ramdas Teelucksingh, who incidentally will be celebrating her birthday as well in the month of May the 25th. Mr. Sat Budram, who celebrates his as well on May 4th. And we dip further into the birthday bag. My mother has hers on May the 16th, so that month of May that will be coming up. And some belated birthday greetings as well to Mrs. Carol Bechu Joseph from South Trinidad and Jessie Dukaran, all firm fans and viewers of Doctor in the House. So, and we certainly want to say thank you to all of our callers, viewers. We want to thank all of those who have sent all the messages and emails about our show. And we look forward to the new season when we resume in September, I think. So we would have a few more episodes leading right up into the month of Ramadan. Right, I think we have our first caller for the evening. Welcome to Doctor in the House.
Hello?
Hello, welcome, sir.
Good afternoon, sir.
Thank you for joining us.
You were speaking about benign prostate hyperplasia just now.
Yes.
I would like the Minister of Health, this is my reason for calling, to let him know that the machine in the Port of Spain hospital is not working for the longest while. So everybody, when we went there, just keep getting put off, and put off. So whatever growing inside of you,
Yes.
by the time they're ready for you, they just tell you go lay down in the oncology center and dead.
Oh boy. Yeah.
That's just how it is there.
Yeah.
Right now, they give you an appointment till the end of the month. And after they take your test,
Right.
you get 6 weeks after, probably, hopefully, to get the result. So by that time, you're dead.
Thank you very much for sharing that to do with us. So I'm sure that those experiences, it's important to highlight these at all of the RHAs nationwide, that perhaps we must be more vigilant and must be more aware. So hopefully persons at the Ministry of Health will be paying attention to that. Not just for prostate issues, but all the specialty clinics nationwide. Thank you for that call, and we return to the phone lines. Good evening and welcome to the show. All right, so while we await our next caller, we were talking about misuse with the prostate, and now most persons, though, will not have prostate cancer. Most individuals, and in fact it's one of those slow-growing cancers. However, it's important to be monitoring. There is still a school of thought that a blood test for prostate cancer called the PSA is not the best screening tool. We mentioned about mammograms not being the best idea in screening for breast cancer. We know about pap smears being so useful for cancer of the cervix. But the PSA blood test, although I still request it in men above a certain age, especially if there's a family history or in a high-risk category if they're having symptoms, we still request an annual PSA in men. But persons are often advised about a rectal examination. There's even a school of thought that as a screening test is not as good and not as valuable in actually the detection of early prostate cancer too. And persons may be sent for scans of the prostate, they may be sent for ultrasound scans, and even a prostate biopsy. So there is actually a host of investigations when we're thinking about somebody with prostate disease, and I think it highlights the need to have a streamlined service for men accessing healthcare in the nation's institutions. Right, we return to the phone lines now. Good evening and welcome to Doctor in the House.
Welcome.
Hello, thank you.
Yes.
You're on the air.
Yes, good evening.
Good evening. Thank you for joining us.
Yes, doctor, I would like you to tell me what fat liver means.
Okay, right.
Fatty liver.
Fatty liver, right. So,
Yes.
and this is a common problem. I know that in the news that we were speaking about problems with weight gain and obesity, like diabetes and high blood pressure, cholesterol issues, maybe strokes and heart attacks. And sometimes as a result of increased weight gain, you may find that we're seeing a lot of patients now with what is called a non-alcoholic fatty liver. So it may be picked up if your doctor sends you for blood tests. There may be abnormalities in the liver enzymes, and then he may follow it up with an ultrasound scan or some sort of scan that shows up what is called a fatty liver. So persons who drink a lot of alcohol, that's one of the changes associated in the cells of the liver. So the cells actually may become damaged by the invading fat. But as a result of weight gain, diabetes, maybe an underactive thyroid, if your cholesterol is high, those persons who do not drink alcohol may also find that they get this problem called a fatty liver. The management is still not the best, so there have been some research showing that some of the older drugs that we used to use for diabetes may improve a fatty liver. Diet and exercise remain the cornerstones in the management of so many of these lifestyle illnesses. So a diet which is low in fat, and of course regular exercise and weight loss. There are some vitamins which are touted as being useful for the management of a fatty liver, but the evidence is not as clear whether or not everyone should get these vitamins. Particularly vitamin E in some research was actually found to improve persons with a fatty liver. What we know though is that this is almost a risk factor for persons becoming a diabetic in the future. So if you have a younger person and you send them for an ultrasound for whatever reason, and they've been found to have a fatty liver, that can be a risk factor for diabetes. It is becoming the leading cause for liver disease in the world now. So it's the leading cause for end-stage liver disease. So if your doctor is monitoring blood tests, he's worried about how things are progressing, he may want to pay attention to things like your cholesterol, your weight, the amount of alcohol that you consume, your diabetic status. He may want to look for other medical reasons for why there is a fatty liver. And if necessary, to consider sending you to a liver specialist. So that may fall under the big field of gastroenterology. So a liver specialist and sometimes even a liver biopsy may be necessary. So unfortunately, the latter stages from a fatty liver, it can actually progress into an inflamed liver and even cirrhosis. So it's something that requires frequent monitoring and investigations by a physician. Fantastic question. And let's return to the phone lines. Good evening, and thank you for joining us. Hello? So the phone lines are open. We'd love to hear from you on Doctor in the House. So the numbers are on the screen, 663-8373 or 645-4426. It's the open forum. And as a reminder, we are live on Monday nights with a rerun on Saturday afternoons at 1 p.m. And we will be streaming as well too in time to come. I know that usually a lot of these YouTube videos are put up on the IBN Master site on YouTube, so you can access not just this episode but some of the past episodes of your favorite medical show. So the fatty liver, and we're talking about complications of obesity. I mentioned about the type 2 diabetes and high blood pressure, but there are also some more subtle ones: stones in the gallbladder, problems sleeping like obstructive sleep apnea. Those are persons who may have wide necks and they snore. They're sleepy during the daytime because of problems with the amount of oxygen that they get. It may affect their blood pressure as a result. There is a host of cancers that are more likely to occur in obese persons than in normal weight individuals, such as cancer of the colon, the prostate, the womb, and the breast. So osteoarthritis. So fatty liver is just one of those, one of the complications that we don't often speak about, but it is actually perhaps a silent epidemic when we're talking about obesity. And as we said, a strong association with diabetes and fatty livers. Let's return to the phone lines. Good evening and welcome to Doctor in the House.
Good night.
Thank you for joining us, ma'am. You're on the air.
Yes, I have a little problem. About 2 years now, when I get up at the sole of my feet, like they have little stones at the bottom of my feet. And I ask the doctors here, they don't know what is wrong. I went to Boston, they say nothing is wrong. But some time ago, I had a MRI and all those different tests, and the doctor said it was spinal stenosis. And whatever it is, I have it still. I don't know what to do or where to go for it.
So the sole of your feet, when you get up from bed, so the sole of your feet hurts?
No, it don't hurt. Okay. Now when I start to walk.
Right.
sometimes I would feel a pain
Okay.
more on the side of my knee there.
I see. I see. Thank you very much for that call, since it's a very insightful one, and it could represent one of the issues that a lot of our viewers experience. So you did a scan of your spine, of the lower back, an MRI of the spine, that had raised the possibility of something called spinal stenosis. We know as a result of wear and tear to many of the bones, there may be degenerative changes which are seen on an X-ray or with an MRI. And sometimes these changes may actually press on nerves, and these nerves may radiate down the buttock area, the back of your thigh, and your legs. Persons may have numbness, burning, there may be pains associated with it. But it makes me wonder, though, that when you stand, when you put your weight on your knees if you're getting pain, it makes me wonder whether it may be something new, perhaps something with the knee joint itself, whether there may be issues there. But it can be as a result of nerve impingement, so there may be pain arising from the nerves, or it may be issues with the joints. Now, one of the disclaimers on this show is that we're not attempting to make a diagnosis, just to nudge you in the right direction. Persons with spinal issues may be sent for physiotherapy. There are medications that may sometimes help nerve pain, or neuropathic pain is the medical term used. But it should be done in conjunction with your doctor, and perhaps chatting with a neurosurgeon or a spinal surgeon before attempting to proceed, and following up with nerve studies, maybe blood investigations if they're warranted. Simple blood tests might actually give you a clue if there may be other medical reasons. So we don't want to actually just make an assumption that your symptoms may be purely due to the spinal stenosis that was found on the MRI scan. The knee joint itself may be one of the factors involved, but of course I'm not attempting to make a diagnosis. Chat with your doctor to see whether a new scan, perhaps an X-ray of a different area may be needed, and simple blood tests before thinking about some of the drugs that may be useful to alleviate your symptoms, physiotherapy, and a referral to a spinal specialist. But that's a fantastic question because it's a common issue. And in fact, when we think about issues with the nerve endings, that burning, numbness, and so-called junjuni that affecting the feet, common reasons may include diabetes, drinking excessive amounts of alcohol, a low level of vitamin B12, and some medical issues that may warrant checking for. We return to the phone lines for our next caller. Hello?
Yes.
Welcome to the show. Good evening.
Thank you, doctor. Good night, doctor.
Thank you. Good evening.
First, let me say thank you, and may God shower you with his choicest blessings for spending this time and, about different ailments and things like that.
Thank you very much.
What I'm calling to talk about tonight is my son is 39 years of age, and it's about a year now. He's always sleeping on himself. If he is at home, well, he don't work on weekends, so right through the weekend he will just sleep, just get up, take a shower, eat, and go back and sleep. Lately, dear, his employer realized he's sleeping on the job. I am begging him, I'm saying, Lawrence, please go see a doctor, find out what is wrong. You cannot be, it's not normal to be sleeping like that. Sometimes if he's driving and I'm in the car with him, I have to be, keeping a conversation with him all the time to keep him awake. I am afraid that something may happen one day because of this sleep.
It can be dangerous.
Could you please tell me or help me? I will listen on the phone. I will hang up and listen on the phone. On the TV. Thank you, doctor.
Thank you very much for your kind comments, and indeed for taking the time to call in, because I can hear the concern from a worried mother that there are many reasons for why persons may have excessive daytime sleepiness. We didn't hear exactly if his job involves shifts, because a lot of shift workers may find that they struggle in terms of sleep patterns. We mentioned about one of the risks of obesity, but it can be seen in normal weight persons too, of obstructive sleep apnea, in which persons may snore. They may find that they're excessively tired during the daytime, their blood pressure is elevated, but excessive sleepiness may be due to medical illnesses ranging from uncontrolled diabetes, a low blood count, and underactive thyroid. So there are certain medical problems that have to be screened for. We know that, that men are not the best persons to access health care when we're dealing with things like this. Unfortunately, men don't like to go to a doctor. In fact, frequently when we see them, it's when complications have actually arisen or on the behest of one of their loved ones. In this case, your mother or your spouse. It's something, though, that something that should be encouraged, admittedly, that he needs blood tests, and perhaps there are certain sleep studies. There are investigations that can follow to determine whether or not this excessive sleepiness is due to a medical cause. And you're so right in saying that he has put himself and indeed the rest of the motoring public at risk in case he drops asleep while driving, because that can be a cause of a potentially fatal vehicle accident. So I wish you all the best, but it's important that you don't give up, that you keep trying to encourage him to seek medical attention. It will be difficult, but hopefully he will listen to good sense. Good sense will prevail. That the very first step will be to actually trying to access care, starting with blood tests, thinking about sleep studies, and whether or not any of the investigations that we discussed will be necessary. So let's return to the phone lines. Good evening and welcome to Doctor in the House. Hello? So while we wait on our next caller, I've been talking about the thyroid gland. So this thyroid gland is a butterfly-shaped gland which produces hormones. It's located in the front of the neck and in men below by the Adam's apple. It can be underactive, it can be hyperactive, or it can function normally, but there may be growths or nodules, and sometimes these may even be cancerous. So it's a butterfly-shaped gland, and it produces hormones that regulate weight, heat, and how you feel in general, so the body's metabolism. And an underactive thyroid can sometimes be associated with weight gain, tiredness, coldness, constipation. There may be issues with a low pulse rate and mood disturbances. When the gland is hyperactive or overactive, you may actually find that there's weight loss, sweating, nervousness, anxiety, the heart may race. So your doctor may want to consider doing a blood test, sending you for an ultrasound scan if the gland is enlarged. So that term is a goiter, from the Latin word for throat, when the gland is enlarged and you're looking for nodules and for growths, and some persons even need a biopsy to follow up. So if the gland is very much enlarged, it can actually squeeze on the windpipe or on the gullet, so there may be issues swallowing or breathing, and those persons may even require surgery. Right, so let's just take a short break in the midst of our calls. It's part of the open forum on Doctor in the House, and as usual, we have a bit of the lighter side. So I thought that after the Ramadan and diabetes video that we would just launch straight into our calls, but the lighter side with the compliments of our studio audience. On our last episode in March, there was a classic show, a sitcom that ran in the United Kingdom in the 1970s called The Two Ronnies. And there was a video with a visit to the doctor. There's also a classic sketch that shows a visit to the opticians. Let's have a look.
Hello? Anybody there? Ah, good morning. I'm sorry, I meant... Oh, sorry. I meant to, I meant to,
Good morning, Miss Prendergast. You're early.
Good morning.
Oh, I'm sorry. Good morning, sir.
Good morning. Could I have 2 pounds of potatoes, please?
No, sir. This is an optician, sir.
What?
Opticians. Look, it says so over the door.
Oh, sorry. Well, it doesn't matter, because I was coming in here anyway, because I've got it down on my list. Greengrocers and optician, you see?
Oh, I see, yes.
It was the wife's idea, actually.
Oh, yes. Well, do sit down, will you?
Thank you very much. You're new here, aren't you?
Yes, I've been here about 6 months, yes.
Yes, I thought I hadn't seen you before.
Yes, the other lady left to get married.
But you're not a lady, are you?
No. I just took her job, you see.
Yes.
Would you care for a cup of tea? I just made one.
That's very nice, yes.
Now, tell me, what seems to be the trouble?
Well, I've just got the feeling that my sight isn't quite what it used to be, you see.
Yes, yeah. Whatever makes you think that?
Well, I started bumping into people at the office, you know, people I work with.
Oh, really?
Yes.
Yes, what sort of people?
Well, the people I share the office with, you see.
Yes.
I kept bumping into them and realised I hadn't seen them properly for a long time.
Oh, dear. Do you take sugar?
No sugar for me.
Right, there we are, then. You have that. Do sit down and we'll see if we can work something out for you.
Thank you very much. It can be rather inconvenient, you know, spectacles, and I don't know, do you wear them at all?
Well, I must confess, yes, I do wear them, yes, but only for reading and for seeing things, you know.
Yes, well, I was passing by, so I thought I'd just sort of pop in, you know.
Yes. Well, you obviously need something a lot stronger.
Yes, I do. Thank you very much.
Well, I tell you what we'll do.
Yes?
We'll just have a look at some eye charts, shall we?
Yes.
And we'll test your eyes.
Right, yes. Is there a dog in here?
No. That was me. I was just scratching myself, you know. Right, now then, let's start. Before we start, would you take off your glasses, please?
Yes.
Are they off?
Yes.
Oh, good. Yes. Well, let's start here from the top. Would you reading?
Right. I'm sorry. Could you wave your arms about? I've lost my sense of direction a bit.
I'm over here.
Oh yes. Sorry. That's it. Yes. Right. No, I'm afraid that's completely stumped me, that chart. I'm sorry.
Don't worry. We've got plenty more. Try the one on the back. There.
A?
I say try the one on the back.
No, A.
Oh, A. No, not A. No.
B?
No, keep
C?
going.
D?
Keep going. No.
E?
Very good, yes, E. Try the next line, would you?
No, sorry.
Don't worry, I'll give you a clue. What do you see with?
Your eye?
Eye. Very good, eye. Yes. And what do you do with your eye?
See?
See. Very good indeed. Very good, yes. Now then.
Yes.
Try the next line on your own.
I'm sorry, is there a next line? I can't...
No, probably not.
You know, I'm sorry, I have to say this. I almost didn't see any of that last chart.
Oh, don't worry. It's just a question of trial and error.
Yeah.
Trial and error. Don't worry about it.
Uh-huh.
Now then, let's have a look here. What about that?
A?
A, yes, good. And I didn't help you at all with that one, did I?
No, I got... I?
No, that's the hat stand.
Oh, H.
Hey, no, you're reading all the furniture. See if you can grab the end of this long pole.
Yes,
I got it. Have you got it?
Yes.
Oh, thank goodness for that. I'm just going to get the test frames now. We'll try a few lenses.
Right.
All right? Yes, here we go. Right, here we are. Now we just put these on. That's it, are they all right?
Yes.
Good, now then. First of all, we have to black that one out, you see?
Yes.
Now, let's have a look one of these, shall we?
Uh-huh.
There we are. Now tell me, is that better or worse?
That is worse.
Oh. Well, let's see now. What about it? What about that? How's that?
That's fractionally better.
What about if I do...
Oh, no, that's worse. No,
That's it. Well, that is your prescription. Then all we need now is to find out what sort of frames you would like. Yes? Right. Off we go. Follow me. Right. Oh, sorry. Now, let's see what sort of frames we've got here. Now, here we are. Try this nice red pair on. There we are. Let me have those. Thank you. Try those. Have a look at those. There you are. Look in the hand mirror. See what you think.
I think this makes me look a little old. What do you
Oh, yes, it does, doesn't it? Oh, wait a minute. This is not a mirror. This is a photograph of an old lady. Oh, they're no good at all.
Have you any others at all?
There's these.
No, what about these? These are... Oh, wonderful! I can see everything as clearly as I... Oh,
No, they're mine. They're mine.
No, these are yours. There.
Are you sure?
Yes, you...
Good gracious. I can see it. I mean, the whole thing's become clear to me. Wonderful.
Isn't that lovely? I trust you'll just send me on the bill.
Certainly not. I wouldn't dream of such a thing. No. I mean, you've helped me just as much as I've helped you. It's been very kind of you to say.
Classic sketch from the two Ronnies, a visit to the opticians. So let's take a short break and stay with us. Don't go anywhere. Welcome back to Doctor in the House and the theme Healthy Lifestyles. So it's a reminder, it's my last show for this season and we will resume in the month of September. But it's a reminder that I want you to be maintaining a healthy lifestyle while we are away. A diet rich in fruits, vegetables, nuts, peas and beans, low fat and low salt, fish, stopping smoking, a moderate amount of alcohol if you do drink, but if you don't drink, don't start. And of course, avoidance of stress and avoiding a sedentary lifestyle. So ensuring that you keep active, whether by walking, running, jumping, Zumbaing, however you're going to fight and dance away from diabetes, high blood pressure, and all of the chronic medical diseases. So in closing, we just have a bit of an inspiring video, which I thought would be an ideal way to sign off this season. Let's have a look. Be kind, and love and blessings to all of our wonderful callers and viewers. Thanks to a genial studio audience and brilliant IBN crew. Good night, God bless, and Ramadan Mubarak.